so that you're absolutely crystal clear on what we're trying to accomplish here. Okay? So let's get started. I authored this about 10 years ago. This was in Dynamic Chiropractic. Okay? And this should be 30 years, is what it has been now. It's amazing when we look back at 30 years that we here in Oklahoma have had the authority to administer injectable nutrients to our patients and the benefits that our patients have derived from those clinical abilities. Actually, we have been quite blessed because we have been able to adjust our patients' subluxations. Make no mistake, that's still the foundation of our healing art. But let me make something very clear. It may not be the ceiling of our healing art. It's our foundation and should always be protected. Okay? But it's not necessarily the ceiling. Everybody clear on that? Alright, so actually we've been quite blessed because we can adjust our patients' subluxations, utilize physical therapy, perform lab studies, and legally utilize chiropractic injectable nutrient protocols to help address a large range of our patients' primary care needs. And this is how far it's come. Check this out, gang. I can remember the very first course in Oklahoma. It was about a 4-hour course. It was bare bones, pardon the pun. Now the coursework is somewhat challenging, but rest assured, if I can learn it, anybody can. And that goes for everybody in this room. I've been the instructor, like I said, now for over 20 years. Trained well over 1,000 doctors. At last count, we're closing in on 1,500 doctors in the United States that I've trained. The current coursework consists of both didactic lecture and hands-on lab. The course covers diagnostic testing, including but not limited to blood lab, urine testing, range testing. How many in here know what range testing is? Let me see your hands. Okay. Range testing is the word that we use for hair analysis. Okay? So whenever we're assessing heavy metals and we're doing it through hair biopsy, that's called range testing. Occult fecal blood studies. For those patients who are geriatric and they're anemic, you better be doing occult blood studies, fecal blood studies, to rule out loss of blood through the GI tract. We're taught that in chiropractic college, but it's never reinforced, and we forget it and we don't do it. Okay? We're going to become excellent diagnosticians, excellent primary care providers, and we're going to blow right past the desire to be utilized by the allopathic physicians for basic primary care, along with our chiropractic expertise. Functional medicine testing, EKG, circulation studies, pulmonary testing, and more. It also covers, the coursework also covers emergency procedures and a spectrum of injection techniques. As we go through this coursework, we're going to be teaching you everything from intramuscular injections to trigger point therapy injections to mesotherapy injections for aesthetic medicine and pain control, to neural therapy scar injections from Germany, to ultraviolet blood irradiation, prolozone joint injections, prolotherapy joint injections. The list just goes on and on and on. And what we're doing is we're using predominantly all natural medicine articles. Okay? No hardcore drugs here. Those injection protocols are taught to, well, here we go, what I just said. From mesotherapy injections for aesthetic medicine issues and for organic disorders to B12 shots. The nutritional substances that we use extend from B12 to ascorbates, from trace minerals and amino acids to homeopathics and specialty nutrients such as germanium. The incredible marriage of chiropractic adjustments and chiropractic injectable nutrient protocols, along with oral nutritional protocols, we have found can replace the need for about 80% of prescription drugs utilized in primary care practice. The appropriately trained and certified doctor of chiropractic and injectable nutrient protocols is not only successfully treating those traditional lumbar spine, cervical spine, and headache cases, but are conquering those primary care patients with chronic fatigue, migratory arthritis, Crohn's disease, cardiovascular conditions, infections, and more. In my particular practice this past week, I had an irritable bowel case that had lost down to 84 pounds. Okay? She was female, so she was right at the tip-over point. Once the female hits 84 pounds, the amount of visceral protein loss just to sustain normal physiologic function is accelerated. And those folks generally will have anywhere from 4 to 6 months to live, if that. Okay? So we got to her just in the nick of time. Last week I also had a Lyme's disease case. 4 years ago we treated 72 Lyme's cases in my practice. In the state of Oklahoma, according to the CDC, there's no Lyme's disease. Well, unfortunately, there is. Okay? You guys will be able to do exactly what I'm doing. And you're going to be able to help a whole lot more patients because of it, and you're going to be able to make a better living because of it as well. In those states where the legal authority for chiropractic injectable nutrients already exists, we are seeing that more and more often. The doctor of chiropractic is the first doctor being sought out to address primary care disorders. Speaking just of Oklahoma, when one looks at the fact that the doctor of chiropractic has administered well over 2 million intramuscular nutrient injections, that's huge, okay? And tens of thousands of IVs without a single serious incident. I've rendered over 60,000 IVs myself, okay, in all the years that I've been doing this work. The Oklahoma doctors of chiropractic have not only proven their skill and acumen for integrating these therapies with their conservative chiropractic care, but more importantly have become the primary care provider of choice in many patients. Okay? Have we had an adverse reaction in Oklahoma? Yeah. Was it done according to the protocol that I taught? Absolutely not. Okay? Did it get splashed all over the headlines? No, it didn't. Okay? So it's, are we going to have some bumps along the road? Yeah, any profession did. We did whenever we started. Okay? But the fact of the matter is, what we're going to have to offer our patients is just going to be so timely because we need it. You know, our patients are drugged to death. Okay? The straights don't want to hear us saying that because they're thinking that we're going to drug them to death. It couldn't be farther from the truth. Okay? We're trying to do something for the survivability of this profession. I don't want it to just survive. I want it to thrive. That's what I want it to do. Okay? Let's see. Okay? Yeah. So that's the injectable nutrient article that I put, that I wrote in Dynamic Chiropractic years ago. And I was certainly happy that they went ahead and included that in their magazine. I guess you probably saw recently where the editor-in-chief of Dynamic Chiropractic has kind of come out against this movement. Unfortunately, I believe that he is ill-informed. And as a consequence, it's going to be up to us to politely inform him. Even though we're receiving not too polite gut shots at us for what we're trying to do, we've got to be polite in our response and in our efforts to try to educate those who are not up to speed on what this is all about.